I am Muhammad KHALED ZUBAIR. I made this video for men. Prostatitis is a health condition that's estimated to affect as much as 25% of men who visit their doctors, and if statistics are altered to include people who have been treated, as much as 50% of all men will eventually experience prostatitis at some point. It's usually an expected condition with older men, though it can be seen as early as the late 20s or 30s, and the easiest way to spot it is to ensure you make regular appointments with your doctor or urologist. Prostatitis is the inflammation or infection of the prostate, and it can be a condition that's both uncomfortable and painful. The condition should be taken seriously. Untreated prostatitis puts you at a much higher risk of developing prostate cancer. If you spot any of the symptoms in this article, make an appointment with your doctor. Here are 11 important symptoms of prostatitis for men to know. 1. Increased urination. Increased urination is a very commonly experienced symptom of prostatitis, and it's seen in most diagnosed cases. The instances of increased urination can be due to the fact that the prostate, bladder and sometimes everything around it will be inflamed. It can also be due to the fact that some prostate swelling is associated with the condition, which in turn can put a very uncomfortable amount of pressure on the bladder. Increased urination can also be a symptom that indicates other health conditions, such as underlying infection in other parts of the body, or an early warning sign of impending diabetes. When it comes to being a symptom of prostatitis, increased urination is more likely to occur at night, and you should see your doctor if this symptom sounds in any way familiar. This symptom will also usually go away once the condition is treated, and can be managed with the right medication in the meantime. 2. Blood in urine. Seeing blood in your urine is a very common symptom that tends to scare people a lot when they see it, though in most cases, it doesn't mean anything fatal and is likely just due to some kind of infection. You should note when and how this happens, and you should also make sure to note the time and frequency, as well as any other symptoms you might be experiencing with it. This is important so that your doctor can make an easier diagnosis when it comes to what's causing the blood in your urine. There are other health conditions which can cause or trigger this symptom, including new medications you are taking, in which case, you should stop taking them and give your doctor a call. Physical trauma, which could indicate internal bleeding, or infections. Blood in the urine could also indicate problems with your kidneys. If this symptom persists, it's always a good reason to see your doctor. 3. Fever or chills. Normal human body temperature is usually around 98.6 degrees Fahrenheit. Anything that goes over 100 and we can say that your body is experiencing a fever. This is usually your body's immune system reacting to an infection, and it's your body's way of trying to fight the raging infection inside your body, though the first thing that you should do if you have a fever is to try bring it under control. Paracetamol can help to break a fever, but you should keep in mind that it doesn't mean it will fix the cause of what's wrong with you. If you have a recurring fever, there's almost always an underlying cause behind it that will need medical attention, and you should see your doctor the moment you spot recurring symptoms like this. Natural remedies to control a fever can be exceptionally dangerous, including throwing someone into icy water to get rid of a fever. This can just send their bodies and heart into severe shock. 4. Back pain. Back pain is a very common symptom experienced by people suffering from advanced prostatitis, and you should know that pain experienced in the back, especially lower back, aren't always due to the spine or muscles around it. Of course, this makes it easy to misdiagnose, too. There are many different things that can cause back pain that aren't directly related to your heart. Among other things, you can have back pain if you have problems with your liver or kidneys, and recurring back pain can also easily be indicative of prostatitis. If you can combine any of the symptoms on this list with the back pain you've been experiencing, or notice that painkillers aren't helping your back or even making the symptom worse, then you should visit your doctor and establish the root cause of your discomfort. If as much as 50% of men experience problems with their prostate in their lifetime, can you really afford to ignore it? 5. Bladder pain. Bladder pain is a very common symptom often seen in prostatitis, and you should take note if you experience bladder pain at any point. It's something that's easy to ignore or put down to something like a bladder infection, but if you treat what you thought it could be and turn out to be wrong, then you should stop trying to treat anything yourself and make an immediate appointment with your doctor. Bladder pain can be due to things like a simple bladder infection, but if you are combining several of the symptoms on this list with one another, then it's almost certainly a sign of something wrong with your urinary system, and more specifically, it could likely even be attributed to underlying prostatitis. When seeing your doctor, remember to give them a thorough run-through of the symptoms you have been experiencing and the circumstances under which they happen. This can help your doctor to diagnose any medical conditions you might be suffering from, including prostatitis. 6. Discomfort or pain in the testicles. Discomfort or pain experienced in the testicles is a very common symptom that can usually be associated with prostatitis, though there are plenty of different medical conditions that can cause it. You should be concerned that it might be prostatitis if you experience this symptom more often, and then in combination with any of the other symptoms that are mentioned on this list. It's a symptom that can cause a lot of discomfort in general, but it's something that a lot of men consider too embarrassing to tell their doctors, and so it never gets the attention that it deserves during an appointment, and can sometimes lead to misdiagnosis because the doctor wasn't given all of the information. Experiencing discomfort or pain in any part of your body is nothing to be embarrassed about, and could save you from a lifetime of medical problems, including a higher risk for developing prostate cancer. 7. Painful ejaculation. The symptoms of prostatitis aren't just limited to experiencing pain and discomfort in the bladder, lower back or testicles. You could also experience pain when you ejaculate. This is another symptom that most men will consider too embarrassing to ever tell their doctors, though this is where the danger for this condition lies. If you are experiencing painful ejaculation at all, then you should see your doctor so that they can find out what's causing it. In most cases, it's a simple issue with your prostate that might just take a proper course of the right treatment to resolve. Ignoring a symptom like pain during ejaculation only means the problem will likely become a bigger one, and it could start to affect other areas of your life too. You should see a doctor if you experience this symptom, even if you aren't showing any of the other symptoms mentioned on this list, and there's never any reason to be embarrassed in front of a doctor. 8. General infection. Prostatitis can also be associated with a general infection happening somewhere in the body, and with a general infection you might also experience very similar symptoms than the ones that have already been mentioned on this list, including running a higher than normal body temperature. General infections can make your body respond in a range of different ways, and just one of these possible ways is reacting with a fever, or reacting with another infection in turn because your immunity is lowered and you are more at risk. Prostatitis can describe several different bacterial infections that affect the prostate, and can thus go together with a range of different infections that can affect the rest of your body. Even a generalized infection is never something that you should try to treat by yourself. It needs specialized medical attention and the right course. 9. Acute prostatitis. There are several different kinds of prostatitis, though you are likely to experience some or all of the symptoms mentioned on this list with the different types. Sometimes you can even have more than one type of infection affecting your prostate, and all of them can up your risk of developing prostate cancer. Acute prostatitis is one such condition, and it can mean that the bacterial infection is particularly virulent, though again, this is easily managed by seeing your doctor and getting a prescription for the right medication to treat the corresponding infection. There are many different forms of prostatitis out there, and this is why it's so important for you to see a doctor if you are showing any associated symptoms. This can help you to get the right condition diagnosed early on so that it can be treated in the right, most effective way. And if you aren't happy with the first doctor's opinion, then you have the right to insist on a second opinion at all times, of antibiotics, which have to be prescribed by a doctor. 10. Bladder infection. There are many urinary symptoms which can be connected to a prostate infection such as prostatitis, and you could easily develop other infections as a result of prostatitis. Repeated urinary tract or bladder infections are common, and a lot of the symptoms mentioned here for prostatitis will also happen if you are suffering from one of these infections. This can make it hard for people to figure out just what's been causing their repetitive symptoms. If you keep treating a bladder infection and it keeps coming back, then you have reason to make an appointment with your urologist and have your prostate checked. It will take just a few simple tests to establish what's the root cause behind it, and these tests are, luckily, limited to urine tests, so they're relatively non-invasive. Symptoms of a general bladder infection are usually noticed first by most people when they urinate too much, too little, or it becomes painful or uncomfortable. 11. Retaining urine. The prostate is connected very close to the urinary system, and it's no surprise that many symptoms affecting the prostate will also affect everything around it. There are plenty of urinary-related symptoms here, and in addition to bladder pain or increased urination, you could also experience bladder pain and the opposite, retaining urine instead. Most people have established a urinary rhythm throughout their lives, and we can say that this is their baseline of normal. Anything that's more or less than that means their bodies are trying to tell them something, and it's best to listen up. If you are retaining urine, you are retaining water, and this can cause a range of other problems with your health, including swelling and extreme pain. With this, you might also notice that when you actually deurinate, it never feels like you're finished, and there's usually a trickle or drop left. This indicates issues with the urinary system, and could be a warning sign of prostatitis. Please like and subscribe my channel and press the bell button to receive video updates. Channel name, KHALED ZUBAIR. Thanks.